Hi guys, welcome back to my channel. Today we'll discuss about headaches in pregnancy, which is a talk which came in 2014, as you can see here. So this talk is very important because there are so many questions from this talk. So we'll just discuss as a generalized topic. Okay. So headaches, they are very common in life, and during pregnancy, headaches can be benign like migraine and all, or there can be serious headaches also. Okay. So we need to see the headaches with like headaches can be of two types in pregnancy, like primary headaches, secondary headaches. Primary headaches means migraine, tension type of headache in that way. So migraine, you have that photophobia and all that lightning, unilateral headache and all. Tension type of headache, you have a band like type of headache. Secondary headaches because of secondary reasons like hypertension, subarachnoid hemorrhage, nifedipine if they use also people will be complaining of headache, postdural puncture tap, meningitis, cerebral venous thrombosis, anemia can also cause headache. Caffeine withdrawals. People are taking like coffee every day and suddenly they got pregnant and they stop coffee. So they get headache. That is caffeine withdrawal. Then IIH, that is idiopathic intracranial hypertension, stroke, AV malformations, enlargement of pituitary tumors, enlargement of hormone-sensitive tumors like meningiomas, leading into pre-existing tumors, cerebral metastasis of choriocarcinoma. Choriocarcinoma, if she is pregnant with choriocarcinoma, cerebral metastasis also results in headache. Okay, these are all different secondary headaches. Okay, yeah, this is very important. Red flag features of secondary headache, like thunderclap. If you see, like you'll get headache. In 5 seconds, you'll get very severe headache. Okay, very severe headache. You'll get that. It's called subarachnoid hemorrhage because of subarachnoid hemorrhage. That you know, that you know, and headache awakening the patient. Like patient get headaches, so that's that much severe that patient need to get up from the bed and need to catch the head in this way. So that is in case of migraine and also raised intracranial pressure. Jaw claudications, it is in case of giant cell arthritis. Yeah, this is very important. Post-dural puncture headaches. Okay, post-dural puncture headaches like after epidural or needle, if it is puncturing into the dural matter, then almost 70 to 80% people will have this post-dural puncture headache. Okay, uh, puncture of dura is rare condition. It occurs only around 0.5 to 0.5, 0.5 to 2.5 around only there is a puncture. But if it is punctured, then 70 to 80%, almost more than half of the patients will land in post-dural puncture headache. You can keep a epidural blood patch on that, and it has a cure rate of 60 to 90%. Okay. So frontal and occipital region will have headache, and typically patient will have headache. Like today you did cesarean with spinal or epidural. Today you did epidural cesarean. On the 24 to 48 hours, the patient will complain of severe headache. Okay, it can be post-dural puncture. Neurological examination is also important. We need to see fundoscopy, cranial nerve assessment, pupil reaction, eye movement, power. Okay, heel toe walking of the gait. You will see those. You should assess that. And if they gave a picture of this, then this is a papilledema picture. If you see, this is an optic disc which is very pale, and there is tortuosity of the vessels. Okay, so uh, and the retinal veins pulsations, they can be seen in a live fundoscopy. That will be what you say. There will be loss of those pulsations near the disc. Okay. Coming to next headache is migraine. Migraine is very important. Why headaches like migraines are more common in pregnancy? Because pregnancy have a high rise in estrogen. So estrogen results in migraine as well. Okay. Coming to migraine, classically it's a unilateral side pulsating over minutes to hours. It comes moderate to severe intensity. Nausea, vomiting, sensitivity can be. See, this nausea, vomiting, sensitivity is there. Na? These are known as aura. Okay, and there is the sensitive to sound. Okay, aggravated by routine physical activity. If you do any exercise or something, then also people will get migraine headache. Okay, because of estrogen, migraine is more common in pregnancy. Okay, so see, this is very important. Typically, aura involves fully reversible phenomena of vision, sensation, motor power, balance, and speech. Symptoms include flickering of light, spots, zigzag lines, fortification. So yeah, aura means there is flickering of light, there are spots, there are zigzag pattern. These are aura. Instead of that, there is also tingling, numbness, visual holes, scotomas. These are all. Aura is something like on the on the eyesight, like eyesight. If there is flickering of light, spots, zigzag pattern, tingling, numbness, visual scotomas. That is all. Okay. Okay, then first line management only you should go for rest, hydration, meals. They should take meals regularly, relaxation and all. You should generally if there any medications you should go for paracetamol, antiemetics when required. Triptans even only in severe. Okay, this is very important. Migraine means we'll feel treatment is triptans, but no. Migraine first initially you go with the conservative paracetamol and all. Severe migraine then you go for trip. Okay. Tryptophan is 5-HT1 receptor agonist. Agonist, remember that. Okay, so sumatriptan is extensively used. And coming to only severe migraines will use that. Instead of that, you can go for paracetamol. Okay. Yeah, this is very important. Like prophylaxis, if it is required, you can go for propranolol. 10 to 40 milligrams 3 times a day. In a day, you can go for 3 times daily. This tablet. This is also safe in pregnancy as well as in lactation. Okay. Amitriptyline also given can be used. Amitriptyline like 25 milligram at night time also they can use this. Okay. Very important in migraine is this. There is two-fold increase in preeclampsia, 17-fold increase in stroke, and 4-fold increase in acute MI. I remember that 4 walls will be there, na? 4 sections in heart. Right ventricle, left ventricle, right atrium, that way. So 4-fold acute MI, 2-fold preeclampsia, 17-fold stroke, brain. Next, headache in IIH, that is idiopathic intracranial hypertension. So idiopathic intracranial hypertension also has benign intracranial hypertension. Remember that it's a rare condition. It's a diagnosis of exclusion, and there will be a cough, headache, which is aggravated by cough. That is associated with diplopia, visual loss, and papilledema. Okay, so basically it is in case of obese female, childbearing age group, obese female, and it's seen in case of first time in pregnancy also you can see this kind of idiopathic intracranial hypertension. Treatment is lumbar puncture or estrozalamide. Okay. Preeclampsia complicating headaches, we should relate PRES. What is PRES? Posterior vesicular encephalopathy syndrome. So in case of PRES, what happens means there is occlusion of the vessel, so there is extravasation of fluid and there is edema, mainly in the basilar artery. So posteriorly there will be edema, and which we can see in MRI, that is resulting in PRES. So PRES, how to manage means you will manage the preeclampsia, you should prevent seizures, or seizure occur, you should treat that. And if it is everything it is not recovering, you should deliver the baby. Okay. So this diagnostic criteria which they gave here, this is very important. If you see, if question wise, like headache in pregnant, then you should first exclude preeclampsia, eclampsia. Okay. If the headache is in temporal region, then headache has worsened in parallel with preeclampsia. Okay, everything you should relate with preeclampsia, and headaches are at least of 2. In 3 features, 2 should be present, like bilateral location, cholesterol quality, and aggravated by physical activity. Okay, so that's about PRES. Other one is there RCVS, that is reversible cerebral vasoconstriction syndrome. Is also seen. This basically in arteries. Generally, there is a problem. There is occlusion in the artery. Okay, for them you can go for calcium channel blocker, which I wrote here. Calcium channel blocker, high dose corticosteroids, and magnesium sulfate is a treatment. Okay, coming to CVT, that is cerebral venous thrombosis, or this is because of thrombus of sagittal sinuses, and cortical vein thrombosis. This occurs. Okay, so almost in CVT, almost 80 to 90% of the patients with CVT have headache. That is important. Okay. So basically, CT is best, but better than CT, magnetic resonating venography (MRV) is the imaging quality of choice. Treatment for CVT is low molecular heparin, and after treatment also we'll follow up with MRV or MRA. MRV only after 3 to 6 months to see whether that occluded cortical vein has been freed or not. Okay, that's important, and yeah. Yeah, this is important while headache, severe headache in pregnancy, you'll go for CT scans and all. Na? So background ionizing radiation safest risk is 50 micrograms. If you see this, 50 micrograms is the safest risk. And CT, if there is CT head, if it is done in pregnancy, then the fetal exposure is less than 0.005 microgram. Okay, MRI is best, but MRI has hyperthermia and acoustic noise side effects. Contrast media like elemental iodine should be avoided, but gadolinium based contrast agents is safe in pregnancy. Okay, lactating women who receive this iodide contrast or gadolinium can continue breastfeeding. Okay, even if a lactating female has this gadolinium induced MRI or something, then they can continue breastfeeding. There is nothing wrong in that. Okay. That's about conclusion. So these are the things. So I'll just summarize the headaches in pregnancy. So basically headaches in pregnancy like primary cause, primary headaches like migraine, tension type of headache, and secondly because of secondary reasons. So migraine you know already unilateral, and you have aura. Aura means that plotting, jog, a lightening, like scotomas. These are aura, and along with that there is nausea, vomiting. Okay, in migraine as well. So, and migraine, there is unilateral and pulsatile headache is seen. Okay, there is one more headache known as cluster headache. In this cluster headache, there can be ptosis. There is ptosis also of unilateral ptosis is seen. Tension headache, you know, band-like headache. Other headaches like a very important headache is associated with preeclampsia. First, you should rule out preeclampsia and all. So, press, that is posterior reversible encephalopathic syndrome because of basilar artery occlusion. There is edema of the posterior region. So, basically, related preeclampsia. And there is a press not related with hypertension also. It is in the case of some immunological disorders, mainly like SLE, systemic lupus erythematosus. Okay, then you have that's about press, and treatment is you will treat preeclampsia. Other thing is reversible CVS, that is reversible cerebral. Sorry, I am not getting the full form. Reversible cerebral vasoconstriction syndrome. Reversible cerebral vasoconstriction syndrome. In this, arterial occlusion is seen. Okay, that is also seen, and treatment is calcium channel blockers, hydros, corticosteroids, magnesium sulfate. Okay. Other conditions is idiopathic intracranial hypertension or benign intracranial hypertension. That is important. Like you can see in this benign intracranial hypertension, generally there is raise in intracranial pressure. So basically, you go for lumbar puncture or estradiol as a treatment. Other condition is cerebral venous thrombosis. There is thrombosis in the vessel, mainly seen in case of obese female and third trimester or postpartum females. You can see this feature. So for this, you can go for MRV, that is magnetic reversible venography, and you go for no molecular heparin. And after treatment, also follow up MRV is done after 3 to 6 months. Okay, these are different types of headaches and ionizing radiations. If ionizing radiation has been exposed, if CT scan was done in pregnancy, CT head, and fetal exposure is less than 0.005 microgram, and like safe exposure is 50 microgram. Then yeah, iodinating agents like ionizing. Contrast agents like iodinated agents are not safe, but you can go for gadolinium agents. Even in lactation, also you can go for gadolinium agents and safe in breastfeeding. Yeah, that's it. Bye.